Hey, it's Ed here. Today I want to talk about our healthcare system, and more specifically about our mental healthcare system, which is almost non-existent. You know, we go into a doctor's office, usually because something's hurting or something's bleeding, but we rarely address our mental health. And that's a crisis that we're facing in the United States and elsewhere in the world. We go into the doctor, and usually the nurse comes in, they take our blood pressure, our pulse, and our CO2 levels, and ask you a few questions and take some notes and says the doctor will be with you in a moment. And when the doctor comes in, he's usually got his head down first because he's looking at the chart, at the notes that the nurse just took, and his eyes will come up, and when he greets you, or her eyes, but then they go back down to your chart. And as they're asking questions, they're looking at the chart, making more notes. So they're rarely interacting with you, and that's the problem with our medical system. Doctor, in the 90s, Medicare set the standard of 15 minutes for a doctor's visit, and that's what they'll pay for. So insurance companies followed that because they want to standardize the payment of a doctor's visit. But we're not an auto body shop where you can assign the amount of time to replace a fender. We're dealing with human beings. We're dealing with complex human beings that have multiple issues. And, doctors miss a lot. They're limited on time, and, it's not that they don't care. They care. They just don't have the time to go into detail. It'd be great if the doctor sat down with you and asked you a ton of questions and, found out what's really going on with you. Because, the word disease, if you break it down, it's dis-ease. And it actually comes from the root of, it's an old French, des-ease. My French is horrible. Lack of want, discomfort, distress, trouble, misfortune, sickness, inconvenience, distress. And, we rarely address any of those with our doctor. We go in and, hey, doc, my finger hurts. Doc says don't do that. But the doctor doesn't have the time to spend to find out what's really going on. And that's why we have so many chronic illnesses in the United States today. It's because the doctors don't have time to address what's really going on. And the other part of that is nutrition. Nutrition plays a huge part in our overall well-being. And how often do you talk to the doctor about your eating habits or your lack of eating habits? Your vitamins. What vitamins do you take? Do you take vitamins? They don't address any of that. You go in, even when you go in for a physical, there's a list of things. Check. Check all those blood tests. If there's nothing glaring, next patient. And that's where our system is really broken, is we're not looking at the person, the entire person. We're not taking a 360 holistic view of that person and finding out who they are. Is there stress in their life? Are they struggling with anxiety and depression and suicidal thoughts? None of that comes out in a doctor's visit. And part of that is our training system with doctors too. They get very limited psychological training because they pack so much into medical school that how much can they cover? Something's bleeding, easy to see. But if you're struggling emotionally, struggling up here, that's difficult to see. And most people don't want to talk about it. So we need to change the way we look at the person. Start looking at them 360, holistic view of that person. Are they eating right? Do they have stress in their life? Are they emotionally well-being? Have they lost a job? What is going on in their life? Are their relationships good? I'm not saying the doctor should play counselor, but the doctor should take all of that into account when we're treating a patient. So thanks, and have a great day.